So with psoriasis, typically we think about it as being primarily a skin disease, but it also causes inflammation in the entire body. So this low level of inflammation can really lead to these chronic conditions like hyperlipidemia, basically like coronary artery disease. And so actually in 2013, there was a study that came out that said that psoriasis is an independent risk factor for coronary artery disease, meaning that you don't have to be overweight, you don't have to have high lipids, you don't have to have hypertension, you can just have psoriasis, and that alone can actually increase your risk for coronary artery disease, which is essentially, increase your risk factors for having a heart attack. And so we want you to go to your primary care doctor regularly to make sure that we're checking these things regularly. That way we can treat and kind of prevent, the things that we don't want to have later in life. And so it's important not only to treat psoriasis, but also have healthy lifestyle. And so what does that mean? So a healthy lifestyle starts with a great and well-balanced diet. And so eating fresh vegetables, fresh fruit, having lean protein in our diet, trying to deal with stress in a positive and productive way, talking with people about stress, exercising regularly. So 150 minutes a week of regular exercise is really the minimum that we should be searching for. But sometimes it also is helpful to see a dietitian to specifically talk about, what is a healthy diet, because that is different for everyone. And exercising very similarly, right? And for some people, exercise comes easily, for others, not so much. And so talking with a personal trainer, talking with someone that is an expert in exercise can also be very helpful. So over the last 10 to 20 years, we've really had an explosion in new treatments for psoriasis, and that can really change the outcome for patients. One of the things we've talked about a lot is the systemic inflammation that can happen with psoriasis, and a lot of these new treatments really get at that and really help treat that. So right now, I would be really optimistic if I were a patient with psoriasis, because now it's more treatable really than it ever has been before.